So one of the things that we've had to do is actually look at what health is, because for a lot of people health is hospital beds. But our definition is it's definitely not hospital beds, and it interlinks to so many of our other campaigns. Climate change. During the heat wave before Black Saturday, 380 people died. Why did they die? They were mainly low income, and they mainly didn't have access to things like air conditioners, etc, etc. The work Joe was talking about before about the health department and trees, cooling the inner city, it's a really obvious one. Violence against women, more women die because of domestic violence than of any other cause. Homelessness, urban and land use planning, health reform, Denticare, which is obviously one we've been talking a lot about. I went and did some of the door knocking with Adam's office last week, and having formerly worked in a high-rise block where a lot of my clients didn't have teeth and hadn't had teeth for 20 years, malnutrition, chronic heart disease, anything that you can think of that goes with someone who is homeless or low income was around Denticare, was around the fact that they just can't access it. Interestingly, when we did the door knocking, the target group for us is actually young married couples with children who are actually working but they still can't afford dental care. So it's not just, so it's one that's going to go right across the board. So, and rural health, because we always, you know, it's that stuff we're always thinking about what happens in the city, but for rural health all of these things are even worse than they are in the city.
Food security, and that comes into climate change and Murray Darling and that, you know, all sorts of things.
Enabled us to become, you know, potentially in the future become the health party in some, you know, not to stop being the environmental and climate change party, but that it gave us that space to step on so many different issues, and particularly all the innovative work around urban and land use planning is actually around, you know, related to food production, livability, sustainability. So it's kind of getting the health look on everything. But just one thing which I think it gets lost in all health discussions is the health economics and the prevention, the dollars of health.
If we look at a lot of those things on that list, they're all inextricably linked, and the money we are spending, you know, down the track when people become psychotic, when we could have early interventions, is criminal.
One thing that doesn't get talked about in health is infrastructure. So like given agencies, community health centres, hospitals, and any place that actually deals with health is the ability to report and take data in, and actually given them the bandwidth to be able to have an internet connection to their community health service to actually you know, run their practice the way it should be run in real time, rather than having delays of, you know, minutes to open up web pages, etc.
Something that does come up out of the infrastructure question is the use of technology in medicine, and in particular there's a lot of cloud computing stuff going on now which enables remote communities to access high quality health services in the city, and I wonder whether part of the infrastructure issue can take into account that use application of technology.